I am Dr. Nadira Rambukas, and today we are talking about the basics of menstruation as we conduct our series on period education. And we have a special guest today, Dr. Amina Khan, and she's an obstetrician gynecologist at Central Medical Center, and she will be talking today about the various nuances about menstruation. So could you welcome, Dr. Khan. Could you tell us a little bit about what menstruation or your period is?
Sure. Good morning, and thank you very much for having me this morning. It's a pleasure to be here. So menstruation or periods, as it is commonly referred to, begins during or just after puberty. It is a normal part of a female's life, and it is triggered by hormonal changes. Periods typically begin after breast and pubic hair development, and it would occur after the lining of the uterus is built up. If a pregnancy does not occur, then the lining will shed as blood and mucus through the cervix and the vagina.
So for all the young females out there, could you tell us the average age of onset of your period?
Sure. So periods are likely to begin between the ages of 9 and 16 years of age. This would depend on a few factors: genetics, nutrition, and a woman's general health. It usually would begin after signs of puberty, such as breast development and pubic hair development. You can know that your period is about to come through different bodily changes, such as an increase in vaginal discharge, mood changes, mild cramping, abdominal cramping, and some amount of breast tenderness.
Great. So could you tell us a little bit about how often do you get your period, the duration of your period?
Sure. So normally the duration is between 3 to 10 days, average being 7 days.
And how often do women supposed to?
The normal menstrual cycle length is variable between 21 to 35 days.
And when women normally get their period and they start, is it regular or irregular?
Within the first 3 years of menarche, or period onset, as it is called, women can experience an irregularity in the pattern. So they may skip 1 or 2 months, and this can occur up to 3 years after the onset of periods.
Right. And how often do women normally get their period? Is it supposed to be clockwork, like every 21 to 28 days?
Yes, average is 28. However, the cycle length could vary between 21 to 35 days, and this is normal.
Right. And let's talk a little bit about something called premenstrual syndrome. Mm-hmm. So what is it, and why do women get it?
Mm-hmm. So sometimes, for some women, some women will experience, unfortunately, PMS, and it could be disturbing. It could affect their lifestyle. However, if it is very mild, then they can cope with some of the symptoms. So PMS, or premenstrual syndrome, can be accompanied by symptoms that can occur up to 1 to 2 weeks even before your cycle begins. And these would be symptoms like bloatedness, mood changes, irritability, breast tenderness, or even sometimes spotting.
Thank you. And normally, some women have different types of colors of their period blood. Could you explain the different colors and what they mean?
Sure. So it is healthy to have a normal red-colored blood flow. However, at the beginning and at the end of your cycle, the blood can be dark brown in color, and this is normal as well. However, if it is that you notice colors such as gray, pink, orange, green, or black, then these are abnormal, and it is indicative that there can be an infection or other issues, and you should definitely seek the advice of your healthcare provider or your gynecologist.
What other symptoms does a female have to have before she seeks medical help?
Sure. So if periods are extremely heavy, so it's associated with huge clots, flooding, which is where even though you're wearing a pad or a period underwear and you are actually bleeding through it. If you have severe abdominal pain, and this is pain where you are required to use painkillers or even more and more painkillers without much relief. It's also affecting your daily lifestyle. You can't work, you can't go to school, or if the periods are extremely irregular. So you're missing more than 3 months consecutively. These are red flag signs, and you definitely need to see a gynecologist for an assessment.
Right, thank you. Could you just summarize the normal onset, duration, and frequency of a period for women out there?
Sure. So normal, okay, so basically we're starting off at between 9 to 16 years of age. The normal monthly cycle is variable, but between 21 to 35 days cycle length. And this is checking from day 1 of one cycle to day 1 of the second one that is due. It should not be that heavy. It really should be accompanied by mild cramping that does not require any painkillers or very few painkillers.
Thank you, Dr. Khan, for being here today and for informing us about the basics of menstruation. I am Dr. Nadira Rambukas, and we will continue our series on period education.